Hidden heart dangers. 8 medications that may be putting your heart at risk without you knowing. Every day, I sit across from patients who trust the medications they've been prescribed. They take them faithfully, believing they're doing what's best for their bodies. And for the most part, they are. But what if I told you that some of the most common medications, even the ones you can grab over the counter, might quietly be putting your heart at risk? As a doctor who has spent decades studying cardiovascular health, I feel a deep responsibility to warn you, not to scare you, but to empower you. Because knowledge can save lives. And in the case of heart health, it can prevent tragedy. In this article, I'll walk you through 8 widely used medications that research has linked to an increased risk of heart attack or cardiovascular issues. We'll explore why they may be dangerous, who is most at risk, and most importantly, what you can do about it. Let's begin. If you found this information helpful, please give this video a thumbs up and subscribe to our channel for more heart-smart tips and trusted health advice. 1. NSAIDs, nonsteroidal anti-inflammatory drugs like ibuprofen, naproxen. Let's begin with one of the most common categories of over-the-counter medications, NSAIDs. You probably know them by their brand names, Advil, Motrin, Aleve, and others. These drugs are widely used to reduce pain, inflammation, and fever. They can provide quick relief for arthritis, back pain, headaches, and even minor injuries. But here's what many people don't realize. Even short-term use of NSAIDs can increase your risk of having a heart attack. A large study published in the British Medical Journal found that taking NSAIDs for just 1 week could raise the risk of a heart attack by 20% to 50%. Depending on the dose, that's a staggering number, especially when you consider how easily these medications are purchased and used without a prescription. So, how do NSAIDs raise the risk? These drugs interfere with substances in your body called prostaglandins, which help keep your blood vessels functioning properly. When prostaglandins are disrupted, it can lead to fluid retention, increased blood pressure, and narrowed arteries, a dangerous combination that puts added stress on the heart and raises the likelihood of a clot forming. For someone already living with high blood pressure or heart disease, this added stress can tip the scale toward a heart attack. Who's most at risk? People with a history of heart disease, high blood pressure, kidney problems, or those who take NSAIDs frequently or at high doses. What can you do? Use NSAIDs only when absolutely necessary. Keep the dose low and the duration short. Safer alternatives may include acetaminophen, Tylenol, for pain, physical therapy, or natural anti-inflammatories like turmeric, ginger, and omega-3 fatty acids. And always talk to your doctor before using these medications regularly. 2. Antidepressants, SSRIs and SNRIs. Just like NSAIDs, antidepressants are medications many people rely on every day. They can be life-changing for those struggling with depression or anxiety, especially as we age and face the emotional challenges that often come with retirement, loss, or chronic illness. But similar to pain relievers, some antidepressants may carry hidden risks for your heart. 2 common types: selective serotonin reuptake inhibitors, SSRIs, and serotonin norepinephrine reuptake inhibitors, SNRIs, are prescribed under names you may recognize: Prozac, fluoxetine, Zoloft, sertraline, Lexapro, escitalopram, Effexor, venlafaxine, and others. While they work by adjusting brain chemicals to improve mood, these same mechanisms can also impact heart health. Research has shown that SSRIs and SNRIs may increase the risk of abnormal heart rhythms, elevated blood pressure, and in some cases, stroke. They may interfere with how platelets function, which makes blood less able to clot. This can raise the risk of bleeding, especially in the brain, a serious concern for older adults or anyone with a history of stroke or heart disease. That said, mental health should never be ignored. These medications save lives. If you're taking an antidepressant, do not stop it suddenly. This can cause serious withdrawal symptoms. Instead, talk to your doctor. You might explore cognitive behavioral therapy, CBT, gentle exercise, or other lifestyle changes that help support mental health naturally. The key is balance. protecting both your emotional and your cardiovascular well-being. 3. Calcium channel blockers, CCBs. After discussing the risks linked to NSAIDs and antidepressants, let's turn our attention to a group of medications commonly prescribed for high blood pressure, chest pain, angina, and certain heart rhythm disorders, calcium channel blockers, or CCBs. Medications like amlodipine, Norvasc, diltiazem, and verapamil fall into this category. They work by relaxing blood vessels, allowing blood to flow more easily and easing the heart's workload. For many patients, they're a key part of managing hypertension or angina. But like all medications, they are not without potential side effects, especially when taken in high doses or used long-term. Studies have shown that certain types of CCBs, particularly short-acting forms, may be linked to a 25% increased risk of heart attack in some individuals. Why? These medications can cause fluid retention, excessively low blood pressure, and in some cases, disturbances in heart rhythm. When blood pressure drops too low or heartbeats become irregular, the body struggles to circulate oxygen-rich blood efficiently, and that puts added stress on the heart. Who should be cautious? People with a history of heart failure, low blood pressure, or existing cardiac conditions. If you've been prescribed a CCB, be mindful of warning signs like swelling in the ankles or legs, dizziness, or fluttering heartbeats. What can you do? Don't stop your medication without consulting your doctor. But it may be worth discussing whether an ACE inhibitor or a beta blocker might be a safer option for you, especially if you're experiencing side effects. Remember, managing blood pressure is essential, but the treatment should support your heart, not strain it. 4. Certain diabetes medications, especially TZDs like rosiglitazone. If you or a loved one is living with type 2 diabetes, you likely understand how important it is to manage blood sugar levels. But what many people don't realize is that some older diabetes medications may actually increase the risk of heart problems, the very thing people with diabetes are already more prone to. One of the most well-known drugs in this category is rosiglitazone, brand name Avandia, part of a group called thiazolidinediones, TZDs. These medications were once widely prescribed to help lower blood glucose by making the body more sensitive to insulin. However, as research advanced, concerns about their effects on the heart grew louder. A landmark study published in the New England Journal of Medicine found that rosiglitazone was associated with a 43% higher risk of heart attacks and a 64% greater risk of cardiovascular death. The reason lies in the way these drugs cause fluid retention, which can lead to swelling, increased blood pressure, and extra strain on an already vulnerable heart. For someone with heart failure or coronary artery disease, that added stress can be dangerous. So, what are your options? If you're currently taking a TZD medication or have been on one in the past, talk to your doctor. Today, we have safer alternatives like metformin, SGLT2 inhibitors, and GLP-1 receptor agonists, which not only help control blood sugar but also provide protective benefits for your heart. In addition, never underestimate the power of lifestyle changes. A balanced diet, daily movement, and stress reduction can go a long way in managing diabetes and reducing cardiovascular risks. Your heart and your blood sugar can, and should, be managed together, not in conflict with one another. 5. Decongestants, pseudoephedrine, phenylephrine. When cold or allergy season rolls around, many of us reach for quick relief in the form of over-the-counter decongestants. Medications containing pseudoephedrine or phenylephrine, often found in common cold and flu products, promise fast help for a stuffy nose. But what many people don't know is that these medications may pose serious risks for your heart, especially if you have high blood pressure or a history of heart disease. Decongestants work by constricting blood vessels in your nasal passages, which helps reduce swelling and open up your airways. But here's the catch: they don't just work in the nose. These drugs constrict blood vessels throughout your entire body, including those connected to your heart. That means taking a decongestant can raise your blood pressure, speed up your heart rate, and in some cases, even trigger irregular heart rhythms, arrhythmias. For someone with underlying heart issues, This extra cardiovascular stress can lead to chest pain, palpitations, or in rare cases, a heart attack. So who should be cautious? If you have hypertension, heart failure, atrial fibrillation, or even just borderline blood pressure levels, it's best to avoid these medications altogether. The risks are even higher if you consume caffeine, smoke, or take other medications that affect blood pressure. What can you do instead? Consider natural remedies like steam inhalation, saline nasal sprays, or even antihistamines if allergies are the root cause of your congestion. These alternatives are much gentler on the heart and can still offer meaningful relief. Before grabbing a decongestant off the shelf, take a moment to read the label, and if you have any heart-related concerns, talk to your doctor. Your heart deserves that extra layer of protection. 6. Certain chemotherapy drugs, e.g. doxorubicin, fluorouracil. Cancer treatment is one of the greatest battles anyone can face. And while chemotherapy has saved countless lives, it's important to recognize that some powerful cancer-fighting drugs can also place a heavy burden on the heart. Two commonly used chemotherapy agents, doxorubicin, adriamycin, and fluorouracil, 5-FU, have been linked to heart damage, especially when used in high doses or over long treatment periods. These medications can weaken the heart muscle, leading to cardiomyopathy, heart failure, or even a heart attack. The main reason? These drugs generate something called oxidative stress, an internal process that damages heart cells and creates inflammation in the heart's delicate tissues. Over time, this can reduce the heart's ability to pump blood effectively. Fluorouracil, in particular, has also been associated with coronary artery spasms, which restrict blood flow and can trigger chest pain or other cardiac symptoms during or shortly after treatment. If you or a loved one is undergoing chemotherapy, don't panic, but do be proactive. It's essential to have your heart monitored regularly with tests like echocardiograms or cardiac biomarkers to detect any early signs of strain. In some cases, your oncologist may prescribe a medication like dexrazoxane, which has been shown to help protect the heart from chemotherapy-related damage. You can also support your heart by eating a heart-healthy diet, staying physically active as tolerated, and avoiding harmful habits like smoking. Fighting cancer is hard enough. You shouldn't have to worry about your heart in the process. Stay informed, stay supported, and talk openly with your care team about heart protection during your treatment journey. 7. Testosterone and anabolic steroids. As men age, it's natural to experience a decline in testosterone levels. This can lead to fatigue, reduced muscle mass, low libido, and even changes in mood. Understandably, many men seek relief through testosterone replacement therapy, TRT. But while it can help restore energy and confidence, it's not without risks, especially for your heart. Research published in JAMA Internal Medicine found that men who began testosterone therapy had a 30% increased risk of heart attacks and strokes, and this risk became most pronounced within the first 3 months of starting treatment. That's an alarming statistic, particularly for older men or those with pre-existing heart conditions. Why does this happen? Testosterone therapy can increase red blood cell count, which thickens the blood and raises the chance of blood clots, a major cause of heart attacks and strokes. It can also raise blood pressure, lower HDL, good cholesterol, and contribute to the thickening of heart walls, a condition called left ventricular hypertrophy, which makes it harder for the heart to pump efficiently. And then there's a more dangerous cousin of TRT, anabolic steroids. Often abused by younger men to build muscle, these drugs can wreak havoc on the heart and have been linked to sudden cardiac death, even in athletes who appear outwardly healthy. So what's the safe path forward? Only consider testosterone therapy if it's medically necessary and prescribed by a doctor who will monitor you with regular blood tests. Better yet, explore natural ways to support healthy testosterone levels, strength training, eating healthy fats, getting good sleep, and managing stress. Your heart and hormones are deeply connected, so any effort to feel stronger and younger should also protect your long-term health. 8. Proton pump inhibitors, PPIs, like omeprazole, esomeprazole. If you've ever struggled with acid reflux, heartburn, or GERD, Chances are you've been prescribed or reached for a proton pump inhibitor, PPI, at some point. Medications like omeprazole, Prilosec, and esomeprazole, Nexium, are among the most commonly used drugs in the United States. They work by reducing the amount of acid your stomach produces, providing relief from burning and discomfort. But here's what many people don't realize. While PPIs are effective in the short term, long-term use has been linked to an increased risk of heart attack, even in people who have no history of heart disease. One major study from Stanford University looked at the medical records of over 3 million people and found that regular PPI users had a 16 to 21% higher risk of having a heart attack. The suspected cause? PPIs may reduce nitric oxide production, a molecule your body needs to keep blood vessels flexible and open. Without it, arteries become stiffer, and the risk of blood clots goes up, two key factors that contribute to heart attacks. In addition, long-term PPI use can lead to low magnesium levels, which may cause muscle weakness or irregular heartbeats, a potentially dangerous situation for older adults. What should you do? Use PPIs only when truly necessary, and never as a long-term solution without close supervision. Consider safer alternatives like H2 blockers, or natural approaches such as ginger tea, aloe vera juice, probiotics, and avoiding trigger foods like caffeine, chocolate, and spicy meals. If you've been on a PPI for more than a few weeks, talk to your doctor about tapering down safely and finding more heart-friendly solutions. By now, you've seen how even the most familiar medications, those we take to ease pain, control blood sugar, treat a cold, or manage reflux, can carry hidden risks for your heart. And for older adults, or anyone already living with conditions like high blood pressure, diabetes, or heart disease, these risks can be even more serious. But here's the good news. You are not powerless. The first and most important step is awareness. The second is having open, honest conversations with your doctor. Never stop, start, or change a medication without medical guidance. What works for one person may not be right for another, and your health deserves a plan tailored just for you. There are often safer alternatives, both medical and natural, that can treat your symptoms without placing extra strain on your heart. Whether it's switching to a different class of medication, adjusting your lifestyle, or exploring holistic options, you have choices. Your heart works hard for you every single day. The least we can do is return the favor by treating it with care, attention, and respect. Stay curious, stay informed, and above all, keep your heart a priority. If you found this information helpful, please give this video a thumbs up and subscribe to our channel for more heart-smart tips and trusted health advice. We're here to help you stay informed, stay strong, and stay healthy, every step of the way. Don't miss out. Hit that subscribe button and join our growing community today.